This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Mylamin G Tablet is designed to manage nerve pain. It combines gabapentin and methylcobalamin to provide effective relief. Indications and uses. This medication is prescribed to manage nerve pain resulting from various conditions, effectively alleviating discomfort and enhancing the quality of life for individuals suffering from neuropathic pain. How it works. The combination of gabapentin and methylcobalamin works synergistically to reduce pain sensations and promote the repair of damaged nerve cells. Directions for use. Take the medication as advised by your physician. Swallow it whole with a glass of water and avoid crushing or chewing the tablet. It can be taken with or without food, and it is essential not to stop taking it abruptly without consulting your doctor. Possible side effects. Common side effects may include dizziness, sleepiness, nausea, and confusion. If any severe side effects or unusual symptoms occur, immediate consultation with a healthcare provider is recommended. Precautions and warnings. Before starting this medication, inform your doctor about any existing health conditions, especially related to the heart, liver, or kidneys. Pregnant and breastfeeding women should consult their physician before use, as well as those with a history of substance abuse. FAQs. 1. How long will it take for Mylamin G Tablet to start acting? It may begin to show effects within 2 to 4 weeks. 2. Can it manage diabetic neuropathy? Yes, it provides symptomatic relief for nerve pain due to diabetes. 3. Is it safe? The safety varies by individual. Consult your doctor for personalized guidance. 4. Can I stop taking it abruptly? No, always consult your doctor before discontinuing use. Thank you for watching. If you have any questions or suggestions, please leave a comment below.